Hello, my name's Dev Lau. I'm with Jeremy Latham here today, consultant orthopaedic surgeon based in Winchester. Jeremy, can you hear me all right?
Hearing you loud and clear, Dev. Thanks for hosting the meeting today.
No, fantastic. Always great to speak to you. Today I thought we might have a little bit of a chat about hip pain and the assessment of patients with hip pain, particularly sort of older people. I would imagine more of your patients are older rather than younger, am I right?
Yeah, hip arthritis is primarily a disease of getting older. Hips wear out, they become painful. And of course, it's at a time of your life when maintaining mobility is critical. As you get older, you start to lose a bit of bone mass, osteoporosis. Your muscles get a bit weaker year on year. And of course, that affects things like balance and mobility. And that has important consequences, not just physically, because it increases the risk of you maybe having a fall and breaking something, but also psychologically as well. You start to become more inward looking rather than living the remaining years of your life out there with your friends, your relatives, family. So really important to think about not just the issues of pain with arthritis, but also the wider picture of why arthritis is such a disabling condition.
Yeah. Yes, I mean, it's interesting listening to what you say. It reminds me of my mum. I've just been watching her. She's getting slower and slower, getting out and about, and it terrifies me when she goes up and down the stairs.
Yeah, this whole thing about frailty is a big issue, Dev. You know, as we're all living longer, it's really important to put off the development of frailty, which is inevitable. If we live long enough, we all become frail. But the longer you can put that off, the better it is in terms of your general health, both physical and psychological.
You know, for older people, what would your advice be if they're suffering from hip problems or hip pain?
The best thing to do is if you're suffering from pain which doesn't go away, doesn't respond to simple measures like taking some paracetamol, slowing down, or maybe even using a walking stick, if that pain persists for more than a few weeks, have a chat with your GP. It's important to get a diagnosis as soon as possible. Commonly, hip arthritis presents with pain in the groin and the thigh. It's usually worse with exercise and can often wake you up at night. Your GP will be best placed to make that diagnosis and give you the appropriate advice for those early stages. Obviously, if things don't improve, that's when you get sent to go and see a specialist to discuss what the options might be.
But suppose somebody wanted to come and see you without going through their GP, could they do that?
Yeah, of course. We're always open for business, Dev. I'm based in Southampton. I work at the Nuffield Health Wessex Hospital. If you want to be seen by me, you just call the office. Anne and Tracy will take your call, make an appointment to see me. You don't need to come through your GP to come and see me for an opinion. Obviously, I will liaise with your general practitioner once I've seen you. It's important that everyone involved in your care knows what's going on and is aware that you've taken specialist advice. But that's a very well-trodden and normal pathway. And often GPs don't mind at all that you've taken the initiative and have come to get an opinion, because that's one less job for them to do. And of course, they're extremely busy. Their capacity is very limited because of COVID, shielding, social distancing, all those things. So the more you take the initiative to get your problems sorted out, the better for everybody, really, particularly for you, the patient.
One of the things I always hear from people is that, will my GP be upset if I've contacted someone directly? And as you say, they absolutely will not be. You know, they're always kept to the loop with information about what's going on. And all they want is what we all want as doctors is, you know, the patient's best, you know, interests at heart and them to get better. That's all.
Exactly. And if you come and see me and you've got medical problems, I write to your GP and we share the information about your medical problems and we can plan the best treatment for you accordingly.
Excellent, excellent. And on that note, just reiterate again, how could somebody get in touch with you if they want to come and see you directly?
The best way of coming to see me, Dev, is to phone the office. The details will follow at the end of the video. Speak to Anne and Tracy. They'll make an appointment for you. You can contact me through the website, lathamhipsurgery.co.uk. If you go through the contact form there, you'll be sent a wealth of information by email directly. Lots of video tips and tricks about what to expect with surgery, how to manage your rehabilitation, and what to do before surgery as well.
Excellent. Okay, great. Wonderful. Great to speak to you again, Jeremy. And I look forward to our next call.
Good to see you, Dev. Thanks very much. Take care.